Good morning. My name is Joni Pass, and I am the WEN Global Health and Wellness Lead. And today I have our behavioral nurse practitioner, Joanna Lezak, here, and I'm going to let her introduce herself.
I'm Jo Lezak, and I'm the behavioral health nurse practitioner here in Fayette County, one of many, I should say. And I've been doing this job since 2024, January 2024.
Well, Jo, thank you for joining me today. To start off, can you tell us just a little bit about your role as a behavioral nurse practitioner?
So my role consists of medication management mostly. I have clients come in and they come in for different mental health conditions such as anxiety, depression, bipolar, schizophrenia, and we have a evaluation and a follow-up, and I prescribe the medication accordingly and refer them to therapy to one of our therapists on site.
Well, since May is Mental Health Awareness Month and also National Prevention Week, why is this awareness so important right now, and what are you seeing most right now in your practice?
It's important to recognize mental health because of the stigma surrounding it for so long, so many years. We've kind of don't consider it healthcare. So I think it's important to recognize how it does affect us in our lifestyle.
And so with National Prevention Week, it focuses on substance use prevention. How closely connected are mental health and substance use, and how do they really overlap from a clinical standpoint?
So substance use, I feel in my practice, is that people have self-medicated for so long with things on the street that they can get easily, and they've decided at some point that it's not worth it to either be in jail or to have that addiction. So they seek out mental health care for replacement, which you feel like it should be the opposite way. But unfortunately, in our situations, people are self-medicating and then seeking out treatment.
What are some early warning signs that someone may be struggling with their mental health or substance use?
Early warning signs could be loss of job or job functioning has decreased, self-care has decreased, mentally they've let things go, and they can't handle new stimulus. So that could be some signs to mental health decline.
So National Prevention Week focuses on stopping the issues before they start. What actually works when it comes to prevention, and what prevention strategies do you recommend to individuals and families?
So it's about reducing risk factors for the most part. If families could incorporate self-care into their daily life, physical exercise, getting enough sleep, eating the right foods, stop isolating and keeping yourself socially active among people is also key, and talking and reaching out, I think, is most important.
I agree. And then since there's still stigma around seeking help, what would you say to someone who is hesitant?
I think the most important thing, if someone is hesitant at reaching out, is looking online exposure to someone. Maybe they can talk to someone who's already been in treatment and find out from them, like, hey, what's your experience with mental health? It's all about referring somebody to the right person. And even if you find that person, that person may not be right for you. So it's important to advocate for yourself and to speak up when you don't feel like you're getting the best treatment that you can. And or reaching out to your primary care physician first. They get a little hesitant when it comes to prescribing behavioral health medication, so they may have a referral of somebody in mind that they know personally is that person. And that's usually how I get some of my patients, is by word of mouth from their primary care physician.
How can communities support mental health and prevention efforts?
Communities can support it by always having the reduction of the stigma starting early, especially in schools. Making sure kids have access to guidance counselors easier, having access to, if they need IEPs, individual education plans, they know that their parents can ask for those. That's super simple. All parents have to do in school to ask for an IEP is they can write a note on a piece of paper and give it to the school system and say, I want my child to have an IEP. It's as simple as that. It doesn't have to be a big letter. It can be anything. So I think it's important for the schools to start young and knowing that, and parents can also reinforce the idea of talking to your children about their mental health, because our brains are so neuroplastic when we're younger, meaning they absorb so much information, and at a younger age it's easier to form a better self-esteem with children than it is as adults. So earlier the better, I should say.
Absolutely. What message would you like to share during Mental Health Awareness Month and National Prevention Week?
Message I'd like to share is that if you're struggling with your mental health, reach out to someone, anyone, a pastor, a friend, a parent, a co-worker, because I can assure you, Facebook, I can assure you that there is someone out there who is struggling with the same kind of feelings you're having. And if you do reach out, that person may know someone who knows someone who knows someone that's already in treatment. So that's the biggest message I can say, is reach out to anyone.
Absolutely. And then I liked your little thing on the wall. It says, note to self, your feelings are valid, your boundaries are important, you are doing the best you can, it is okay to ask for help, you are worthy and lovable, you are allowed to say no, you are capable of amazing things, and it's okay to start over and try again. So, Joe, thank you so much for joining me today. And
well, thank you, Joni, for interviewing me. I'm glad that I was able to talk about mental health, especially in the month of May, when it is Awareness Month.
yes, it is very, very important. And if you, for any reason, are needing help, reach out to someone. Thank you.